Hi, everyone. My name is Deborah Wafer, and I am with Gilead Sciences, where I work and lead our community engagement and patient advocacy. And for those of you who don't know, Gilead is a biotech company that's located in the Bay Area, and we develop medications for HIV, hepatitis B, C, and D. And then we also have medications for oncology. I'll tell you a little bit more about myself later, but so before I do that, I want to introduce the panel, and I will have Dr. Carlisle, David Carlisle, come up and introduce himself. Most of you probably know him already, but
Hello. Is this transmitting? Yes, it is. Okay, great. Well, I want to say on behalf of everyone at Charles R. J. University, I want to welcome us to the campus today. On behalf of our trustees, of course, our faculty members, our administrators, and of course, most especially, our students. And I think we have some CDU students here today. In fact, I know we do. So if you are a CDU student or even a CDU faculty member, why don't you stand up and be acknowledged? In fact, I'm going to ask you to do more than that. Say which programs you're associated with. You should say your name also.
what's your name?
And David mentioned one of the most interesting, unique, and exciting things that's happening right now at the university. So we're opening our own four-year medical school as we speak. We're matriculating our first class as we speak. That class officially starts, I think, sometime between July and August. So this is a big thing. It's actually a dream that has preceded the formation of this university. But I especially want to welcome our partners who are here with us today. Of course, the LA Chargers. Thank you very much for being here, Chargers. And I'll emphasize the LA Chargers because we were talking about a trivia question. And so the trivia question is, what city did the Chargers start in?
LA.
They've actually come home to Los Angeles. So that's a very cool thing. And this is a trivia question that you only know if you're from Sacramento. What city is the home city of the Chargers family owners? Stockton, California, yeah. And LA. Right down the road from Elk Grove where we still have a house. But the Chargers have been very active in the community since they've been in Los Angeles, and I really appreciate it. I appreciate the fact that the Chargers are in Inglewood, and that we're developing a new kind of economic engine in South Los Angeles around the Chargers' presence and the Rams' presence and NFL Network's presence. This is a very exciting thing for the city of Inglewood. So thank you all for being here. It's great. I also want to welcome, of course, Gilead Sciences, Gilead Pharmaceuticals. We've been partners since I've been president. Deborah has been on our campus, I don't know how many times, a few times. And I just want to commend Gilead for its work in HIV/AIDS. Here in this part of Los Angeles, this is still the largest underserved area in the United States in terms of population. It has healthcare metrics to go along with that. And one of those metrics is that this is still a epicenter for the HIV/AIDS epidemic. It is not over, it's not behind us, it's still burning here in South Los Angeles. And Gilead has played a major role in pushing back that fire. So thank you very much for that as well. I want to say a few words about our university for those of you who don't know us. So we were created in 1966, incorporated in 1966, in direct response to the Watts Uprising of 1965. If you read the McCone Commission report, there's a quote there, and it's on one of our signs out front. It says, "Education, our fundamental resource." That's the title of a chapter of the McCone Commission report, and speaks to why this university was created now 56, going on 57 years ago. We're constantly fighting against what it means to be under-resourced in terms of healthcare. So our mission statement is that we are a university that is committed to cultivating diverse health professional leaders, students, diverse health professional leaders who are dedicated to social justice and health equity for underserved populations through outstanding education, research, community service, and clinical care. That's what our university does. We do that to fulfill our vision, excellent health and wellness for all in a world without health disparities. So I think that's what that really characterizes this university. It characterizes our interest in having the charges here in Los Angeles. It characterizes our relationship with Gilead Pharmaceuticals. And I think it characterizes everything that we're about. And again, I just want to welcome everyone on behalf of everyone associated with the university. I'm looking forward to our session today.
Thank you. Thank you. Our other panel member is Liliana, and Liliana is with the LA Chargers. She's going to come up and introduce herself.
Can you hear me? Okay, good morning. Buenos días. Qué gusto verlos. How exciting to see each and every one of you. And thank you so much for the distinct pleasure and honor to be on this panel with you. I have the audacity to be the non-medical person, the non-medical background person to sit beside these two amazing powerhouses. And we're honored to be on your campus. Thank you so much for your warm welcome. And just meeting your very proud team, your proud students. It obviously is a clear reflection of the leadership that you embody. Thank you. Thank you. And obviously, part of that incredible charm and incredible brain that you help give to the world is through Deborah. So thank you so much for not only paving the way, but creating health equity, a livable and actionable determinant for what is possible day in and day out. So with that, I'd like to introduce myself. My name is Liliana Teresa Perez Palacios, because as a good, mother, a daughter of my mother, I get to be able to give you all of my names. I have the distinct honor of being able to represent the Los Angeles Chargers. I am the Director of Cultural Affairs, a role that was created that is completely not, it doesn't exist in any other club. We designed this 4 seasons ago with the intention of being uniquely reflective and representative of what is Los Angeles. And Los Angeles is so uniquely us in this audience and so uniquely different. And that difference also creates that union and that bond that we aim to achieve. That bond that I get to be able to represent the Los Angeles Chargers in all of the communities, and I get to be able to say, I get to bring the communities back into my esteemed Bolt family. So thank you very much. And my background is before joining the Chargers, I was in state politics for 25 years, serving 6 speakers of the California State Assembly and 1 governor. So one of those speakers so happens to be our mayor, Karen Bass. The other, one of the other speakers so happened to be former mayor Antonio Villaraigosa. And one of the other former speakers so happened to be the past chair of the UC Regents. And the other speaker is our existing president pro tem of the Senate, Tony Atkins. So before leaving the state legislature, I worked with Anthony Rendon, or Anthony Rendon, and I served with him as a statewide director of, deputy director of protocol and international relations. I get to share that with you because humbly, I grew up in Pico Union, very, very impoverished communities, very violent home, very violent community. And I get to share with you, I was undocumented. And I also, but those are the things that were aimed to put me down, like many of our community members. But those are the badges of honor that we carry and we bring with each other in every room we represent. So I'm honored to bring all of me and all these communities that I am a part of to be here before you. Thank you.
Thank you. Thank you. So now I feel like I should probably tell you guys a little bit about myself. As I said, my name is Deborah Wafer, and I grew up in this community. I actually went to Centennial High School, which is right at the corner of. Did you go there? Yeah. Okay. So Centennial Apaches is what we were called when I was there, and I graduated from Centennial and did all of my education in Compton, and then went to college, Cal State Northridge, where I majored in health, community health education, and then came here to Drew to the PA program. So I was in the PA program, one of the first PA programs that allowed women in. The first couple of programs were all folks who had been medics in the military, and we had an issue after the history that Dr. Carlisle just talked about. We had a lack of medical providers, and that's when the PA program was started. And so I came here, I did the PA program, and I helped open up the Department of Family Medicine here on campus way back in the day when Dr. David Satcher was the dean of the medical school, and I was also his physician's assistant. And that's a proud moment for me because David Satcher went on to become head of the CDC and the Surgeon General. So when I put that on my resume, it really kind of gets people's attention. and also, living here in the community and working here in the community, it really was aligned with the things that Dr. Carlisle just talked about. That being of the community, I was one of the people that when I would walk through the emergency rooms, sometimes I never knew who was going to say, Deborah Wafer, because I grew up here, but also being able to advocate for the folks, for the patients, because I knew who they were, and I felt like I am of the community. And then I went on and did a whole bunch of other work, worked at UCLA, working in HIV research, and took care of women who are HIV positive and pregnant, and was involved in a pivotal study that decrease the transmission from mother to baby. So now we rarely have babies who are born with HIV if the mother has been tested during pregnancy. And while working in HIV, I got exposed to biomedical or the pharmaceutical industry. There's no way knew anything about that industry at the corner of El Segundo and Avalon. El Segundo and Central. But I got exposed to pharmaceuticals. I was doing a lot of work with community engagement and went to become a community liaison for the city of Los Angeles for one company. And then continued and continued and continued and continued to where I am now and working now in public affairs for Gilead Sciences, which really kind of put together everything, all of my education. And so I'm very proud to be back here in this auditorium at Charles Drew, and where basically I learned everything about healthcare. I mean, when I came to Drew, we were talking about health disparities and health equity then. It's not a new topic here at Drew. And now, we hear people talk about health disparities, social determinants of health, political determinants of health, and health equity. And sometimes I don't know if people really know what that's all about, because if you haven't worked in a community like this, you might not know what that's all about, and they're just words on paper. So with that, I'd like to turn it over to Dr. Carlisle and ask him about the commitment that Drew has around health equity and how is that played out in the medical education of the students here.
Well, absolutely, and thank you, Deborah. Let me say that I forgot to mention one thing during my introduction. Those of you who know me know that I have a lot of black and gold, which I'm trying to wear today at this event. but I was trying to find something that came close to Chargers blue. And the closest I could come were my socks. So, but I'm going to be working on that. I promised Liliana that I would do that. And so next time you see me, ask me the question. But anyway, CDU is focused on the concept of health equity. We have faculty members, including Juanita. Do you want to mention? Stand up and say hello. Oh, okay. That's why you look familiar. Because I went to college in Middletown, Connecticut.
So you guys know each other?
No. Okay. Welcome. Anyway, I went to Brown also in Rhode Island. Fantastic. Okay. But our faculty members know that we're here because of health equity. Health equity is in our, as I mentioned, it's in our mission statement. We're one of the few universities that you will find in the country, one of the few organizations that you'll find in the country, even in healthcare, that include the phrase health equity in their mission statement. CDU is all about social justice and health equity. And I'll take a risk and go out on a limb because we're still generating data to make this assertion true. But when you look at the big picture of healthcare in the United States compared to the big picture of healthcare around the world, the United States among industrialized nations does not rank #1 on any international measure of healthcare and health excellence. We don't rank #1, despite the fact that we spend 50% more money on healthcare than any other industrialized nation on a per capita basis. So we're spending the money, but we're spinning our wheels. The issue manifests itself right here in South Los Angeles because it's under-resourced communities like South LA where you see the biggest disparities in these metrics that are used internationally. Maternal mortality. I mean, I don't need to say more. Story after story of young mothers. Serena Williams, for example, who die or almost die because of maternal mortality issues. Infant mortality. Diabetes outcomes, stroke, heart attack. It goes on and on and on to life expectancy. These gaps are biggest in communities like South Los Angeles. And it's because of these gaps, these disparities that exist in places like South LA, that the United States is being pulled down in terms of international comparisons. If we can address the issues that face under-resourced communities, we can address issues for the entire country. If we want to improve healthcare in this country, it starts right here in South Los Angeles and places like it all around the country. And if we can improve things in these communities, we'll improve healthcare in the United States. I just want to say one more thing, if I may. There was a recent publication that came out that looked at life expectancy in the United States. And we know that during the COVID pandemic, life expectancy in this country dropped for the first time in over 100 years. That's unprecedented. Since we started tracking life expectancy, it hadn't dropped until we had the COVID-19 pandemic. It dropped the most 3 years and 5 years among African American and Latinx populations. Again, this is where the rubber meets the road. If we want to make the country better, we start in places like South Los Angeles. If you look at the country as a whole, that concentration of life expectancy drop was in pretty much the southeastern part of the United States, where people were refusing to expand the Medicaid programs, and many people were resistant to getting COVID-19 vaccinations. And surprisingly, far in Northern California, the part of the state that likes to call itself the state of Jefferson, because they're so wed to the original concept of the Constitution without things like the 13th Amendment, without things like the 14th Amendment, without things like the 15th Amendment. Very, very conservative part of California, where people were also not getting COVID vaccinated. So these things are all tied together, and I know that we'll go into this further, but I just want to recognize this university, and I want to assert that this university is here to speak to and speak about social justice and health equity. That's exactly what we are created to do. And I think the fact that our mission statement has been consistent for year after year, speaks to the fact that we are committed to this mission. This is why students come to CDU, because we're a very special place.
Yeah, I think one of the things that's interesting about CDU too is when you think about historical um, Black institutions, this is one of the only ones that's west of the Mississippi, and the medical school now, the only one, right?
The only medical school.
The only medical
The only
school
historically Black school west of Texas.
west of Texas. Okay, west of Texas, but the medical school, is it a private medical school now?
Yes, private,
Okay.
not-for-profit.
Private, not for profit. Whereas before, it was 2 years at UCLA and 2 years here. So it was kind of shared.
Yeah, the university is a private, not-for-profit. The medical school, as Deborah is saying, started out has been for more than 40 years a program that we've shared with the Geffen School of Medicine in Westwood at UCLA, where students spend the first 2 years in classes up in Westwood and the last 2 years on clinical rotations at CDU. And so the opening of this new medical school will concentrate medical school students entirely on the CDU campus and CDU programs.
Right. So you just talked about COVID, and we saw that COVID really kind of pulled the covers back and demonstrated the lack of health care in this country and who was most at risk. And most at risk tended to be Black and brown people all across the United States. What are some of the positive things that we may have learned during the COVID epidemic that you think we could apply to healthcare today?
Well, I was recently interviewed by an LA Times reporter, and she asked me about this, about COVID-19. And she said, were you surprised by how the pandemic kind of unfolded and hit communities of color? And I said, no. And she said, you're not. And I said, no, I'm not. Because if you know anything about healthcare in under-resourced communities, what we experienced in COVID-19 in places like South LA among Black and brown communities was no surprise whatsoever. It just underscored the very issue that we are here to address. Everyone at CDU knows about these issues. It may have been a surprise to the outside world, but that just shows how much work is there to be done on this topic.
Right. And coming back to you, in terms of the pandemic, what did the charges do different? Did you guys have any special protocols that you had to deal with?
Absolutely. At the short of it, we had spectatorless season to inaugurate our fabulous home, SoFi Stadium. So the first year to inaugurate this amazing state-of-the-art facility, we had no fans and stands. And so a few of us had the opportunity to attend to be able to take a look at what would it look to have a functional role to take a look at how would it look like when we are able to bring in fans into into our space. But we, together with two other football clubs in California, agreed that we would not bring fans in. We agreed, and we're very clear about the protection of and the integrity and the safety of our fans. Were the most critical priority for us. And so we also adhere some very strict protocols even within our organization. Every member of our team had the ability to be able to get vaccinated, not once but twice. Um, Everybody had the ability to be able to work remotely, and and in that space, and also created community within our own team members, because we self isolate, and sometimes that brings up other mental health issues that um, impacts the day to day. So, in terms of how we adhered, how we followed our protocol procedures, every person obviously, well, at the time, we had doubled up on our masks as well. And we not only, but what we did for community, we're very proud that we not only provided masks to our community members, our sorely hit community members, but we're part of the food regional banks of Los Angeles and Orange County. And we were able to we proudly distribute um, tons of food and sorely needed products for our families for the first time in their life who never faced any kind of experience of asking for support. All of a sudden, found themselves at a crossroads. And so for us to be able to meet them with dignity and no judgment, and families who had some thriving careers, and all of a sudden from one day to another they didn't, but yet the bills continue to mount. So we're very honored to be a part of that process of being able to say, we were part of that communal lift to support our team members and our community. And so that's what we were able to do.
Good, good. I think we all learned a lot from COVID, that because we had to stay at home, right? So you had to watch it on TV, and whereas before, healthcare disparities is something that's been going on, as Dr. Carlisle said, forever. But I think people got a chance to be still and look at it and pay attention to it. And, as a result of that, now we hear more people talking about health disparities and health equity. And there was an article recently about, in JAMA, about how they have folks who are kind of like, what do they call them? They call them like healthcare equity tourists, if you will, folks who are using the term but not walking the walk or talking the talk. And there are lots of money going to different organizations saying that they're doing health equity, but they're not right down here, are they, Dr. Carlo?
Very few. That's why it's an underserved area. Yes.
Right, yeah. So one of the things that I noticed today is that you guys have a science class for children across in the next building over there, and some of the parents are over here with us today. And I was just wondering if you could tell us a little bit about why training or having science Saturdays is important.
Well, you're making me smile because this is a program that only brings smiles to people's faces. So the Saturday Science Academy, two technically, because there was one before this one here. Um, this program's been open for I think 30 some years on our campus, and basically it takes young people from the communities around the university, starting at the age of 4, so pre-kindergarten students, all the way through high school, and it's a science immersion program. And there's several phases of this. For the youngest students in the program, it's basically just getting to know science, showing them that science is a thing, getting them to feel comfortable with science, getting them to do things like look at organs, do kind of dissections, and do some fascinating science tours. And then we culminate it all with what we call the junior white coat ceremony. And again, this is one of the most emotionally dramatic events on our campus, because you have young people 4, 5, 6 years old, and 18-year-olds as well. But the 18-year-olds are a little bit different. I'll tell you more about them later. But you get a 4-year-old up there on the stage, and they recite something about anatomy or physiology, and you're going, "Wow, a 4-year-old can actually pronounce those words? That's amazing." And then we give them a white coat and call them, Dr. Gonzalez, Dr. Johnson, something like that. And you see a light go off in their eyes, and they look at the other folks with white coats that are around. And they say, "Well, maybe I can be a doctor or a PA or a nurse." And so for the first time, they start thinking that maybe this is within the realm of possibility for them. High school students are there or the 18-year-olds are there because they've already kind of committed to this course. We're doing things like SAT preparation and interview counseling with them as well. This program's been going on for over 30 years, and we have students to this day who've been in the Saturday Science Academy, right? Yes. So Saturday Science Academy graduates who are in our residency programs, who are in our nursing programs, and our PA and medical school programs, who are here at the university. And this is a great program. It's empowered. We produce we have about 300 students a year enrolled in the program. So you can do the math. That's about 9,000 graduates from the Saturday Science Academy, virtually all of whom go on to college, many of whom go on to healthcare careers, and most of whom come from under-resourced communities and underrepresented populations.
That's amazing. It makes me think about in some of the Egyptian culture, how they would find young people very early on who were talented and train them in the sciences. And then you have the output is people who are committed. So I congratulate you guys because the science program, I think, is one that opens kids' eyes. But I would imagine the science program could also impact families in a healthy way. You know, have you guys seen any of that where, kids come here, learn about science, and can go home and talk to their families about health and hearts and lungs and that sort of thing?
Well, let me just ask if there's, or ask the Saturday Science Academy
Yeah.
parents to just stand up and be acknowledged if you're here with the program. Yeah.
Yes. Thank you.
And you're absolutely right, because I think in a couple of ways. There's the direct thing, which is the young people are taking lessons from the academy home and communicating the lessons, applying the lessons. But the parents also derive something, which is simply being part of an organization that is committed to the future of their children, basically, and is doing what it can to make that, to assure that future in a positive way. So this is has many benefits for families involved.
Mhm.
And of course, we benefit as well from our interaction with people from the community here at the university.
Right. And the Chargers do things in the community too around health, and maybe you could talk to a little bit about that for us, Liliana.
Proudly, Deborah.
Yeah.
We are so honored to have a partnership with Gilead, and that brings us here to your wonderful home in campus. And so, but we're very proud to be able to say that we are able to partner not only with, we have our own STEM partnership, and we hosted at SoFi Stadium with very large number of high school students they were already camp stars in their own campuses, but get to meet other stars in different campuses and get to be able to create that community that, quite frankly, we uniquely provided for them, and with some amazing members of the Gilead family as well. Um, yes, and we also, to kick off Latino Heritage Month, we did a joint partnership in South LA at one of our local markets, and at several locations where we had, not only did we have um, our mammogram mobile, thanks to Gilead, we also had for those to help screen test in Spanish and in English, our family members in to be able to determine if they qualified to be able to receive this mammogram, and because early detection in our communities is critical to be able to save lives. And so not only did we do that, but for those who did not qualify for the mammogram, we provided them with information for where to go for additional support, a local clinic in partnership with another health facility. So we are very proud to be able to say we are not only in community, but we're intentionally driven, not only creating those early detection centers with you, but also being able to create safe spaces for our children to play in. And we're very proud to be able to refurbish playgrounds so that we can be able to create play as an opportunity, not only for the children, but for the families as well, and to feel proud to be able to call their local park their home. And so part of that is, in the greatest trainings, if we really look at a child, is simply being fun and in the moment. And so we're very proud of being able to say, we are not just we're very clear about how we stay in community and keep it sustainable in community, and by the so you get to judge us by the friends that we have. um,
Yeah, I think that's the two things. One, children being able to play. I think a lot of times black and brown children have to grow up very fast, and they don't have a lot of opportunity to be children, to play and to be physical, if you will, because of lots of other things that impact their life. So the fact that you guys can provide that kind of atmosphere and that kind of playground, I think we need more of that so kids can run and play. I mean, when I think about, how we used to have programs, even here at Centennial High School, we had one of the best football teams and one of the track teams in CIF, and people who went on to become, NFL players and that sort of thing. But it was also now something that people don't have in their schools anymore is to have those kind of extracurricular activities. And then just to double click on breast cancer, I think one of the things that we know about breast cancer in Black and brown women is that it's late, it's detected late, you know. And I remember having a mammogram, a mobile unit here in this community, and there were people who were afraid to get mammograms. And there's a lot of misinformation and disinformation about that. And so maybe we could talk about that a little bit, because I think sometimes the misinformation is what keeps people from getting in early. And it's not that Black women have more breast cancer, it's that they have more severe breast cancer when it's seen. And I think that's, you know, a lot of times we keep hearing Black people have more of this, and Black and brown people have more of this, and we have more of that. And during COVID, I remember one of my friends was like, it's not because we're Black. What is the reason for it? And I think some of the reasons are around miseducation or mistrust, I should say.
Trust, we talked about that because you're also talking about not only is a language as a potential barrier, education is a potential barrier, and also access to services is a potential barrier. You know, we're talking about, you know, legal status as a great concern among our family members, you know, of being able to then don't want to be a public charge because those are one of the requirements when you become a legal permanent resident. Then the question is, you know, what are the services that you've received during the time that you've been here? So, you know, people don't want to access healthcare services because they do not want to be a public charge. And so that's another factor that prohibits, or rather, misinformation that doesn't allow for families to access with dignity healthcare opportunities.
And then there's misinformation, and then there's distrust, right? And I think one of the things around distrust is when we can have more healthcare providers who look like and who can translate. And I think that's what Drew does a really good job of having people from the community train in the community. And how many people stay in the community after they leave here?
Well, our numbers are actually very high in that regard. I think from the medical education program, we've been able to identify that 80% of the graduates are working in underserved areas in their careers. And they go off to various residency programs around the country. So immediately upon graduation, they may be in Boston, or they may be in Seattle. Most of them stay here in Los Angeles, though, or California, to be sure. And disproportionately, far more so than any other medical education program in California, our graduates are serving underserved communities, and our graduates are here in Los Angeles. So we're very proud of that fact, and again, it underscores the fact that we are, you know, we're fulfilling our mission. This is what we were created to do, and I think we've affirmatively said that we're doing it.
You know, just let's back up just a little bit. This is called Charles Drew University. How many of people know who Charles Drew was? Okay. So maybe we could take a minute and do a little stroll down history lane and talk about who was Charles Drew and why did we name the university after him?
Well, we're very proud to carry his name because his daughter, who's on our administration staff, Sylvia Drew Ivy, is not here with us this morning. I didn't see her come in, but so I can say this because she says, Dr. Carlisle, you know, you shouldn't say that. You know, she's very modest. I consider Dr. Charles Richard Drew to be the most preeminent African American physician of the 20th century. There, public statement on the record. You know, IMHO. It's my opinion.
Okay.
But I think it's true. And we're proud to bear his name because he was known as a researcher. He came out of the African American community of Washington, D.C., and went on to become probably one of the most preeminent hematology scientists, although he was a surgeon, in the United States. Ran a very significant program called the Blood for Britain program during World War II. And this is at a time when, during World War II, when combatants on every side, both sides, were dying from blood loss. And because of Dr. Drew and the program that he set up, the Blood for Britain program, before the United States went into World War II. The U.S. was able to send blood and transfuse to Britain and transfuse it into Allied combatants who would otherwise die from their injuries during World War II, saving the lives of thousands of people during the war. When the Axis powers didn't have that program, their combatants died from blood loss. The Allied combatants survived. And today, when we think of healthcare, every time somebody in an American hospital or a hospital around the world receives a transfusion of any type, it's because of the work that Dr. Drew did back in the 1930s and 1940s and 1950s. He unfortunately died early, and if you go into the lobby of the Cobb building, you can see our display on this. He was driving to a medical meeting in Tuskegee, Alabama, at about 5 o'clock or 6 o'clock in the morning in rural North Carolina. The car left the road, overturned. The other passengers were ejected from the car. They didn't suffer significant injuries. Dr. Drew, unfortunately, who was driving, had his foot catching the brake pedal and was only halfway out of the car when the car rolled over him. And his internal injuries were severe. He was taken to a segregated rural North Carolina hospital. And this is where the reality diverges from the myth. The myth is that he was refused care. The myth is embellished by saying that he was bleeding to death, and how ironic the father of blood banks is dying because he can't get a transfusion. The reality, and this is attested to by doctors who were with him, and we have some of the attestations in our lobby that you can read, was that he was actually recognized. He was so well known in healthcare that when he came into the emergency room of a small hospital, he was recognized by the doctors on duty. Is that Dr. Drew? Yes, was the answer. They stopped everything they were doing until they realized it was futile and they couldn't save his life. He had injuries today, transected vena cava, too. But even in the front of sorry, there I go.
That's house equity.
Thank you for calling me out. Don't hesitate to do it again. You all know about the aorta. The aorta pumps blood from the heart, but the blood has to get back into the heart somehow. And think about all that blood that the aorta is pumping, every second. That blood is coming back the same volume into the heart through the two vena cava, the superior vena cava from the chest and the inferior vena cava from the abdomen. Both were ruptured in the case of Dr. Drew. Even in front of a level 1 trauma center today, it would probably be a life-threatening injury, and Dr. Drew succumbed to it. But later on in his career, after becoming the father of blood banking, he went on to become the chair of the Department of Surgery at Howard University and trained any number of significant African-American surgeons who went on to become trailblazers in their own right. So because of all this, we're quite pleased, quite honored, quite privileged, and proud to carry the name Charles R. Drew University of Medicine and Science.
Thank you for that, because I think a lot of people, we see the name, and now it was Charles R. Drew, now it's CDU, and sometimes people might forget that. And I wish Sylvia was here. Sylvia Drew Ivy is a wonderful woman. I had the opportunity to work with her. She was executive director of a clinic over used to be Santa Barbara Boulevard. Now it's MLK Boulevard, called THE Clinic, and it stands for what does it stand for? To help everyone. THE Clinic is the name of the clinic. Anyway, so I wish she was here today. Okay, so now we have the history lesson. We understand what disparities are all about. We understand what the mission of Drew is all about. We understand the chargers are involved in healthy play and involved in the community. Let's talk a little bit about health literacy, because I think that's one of the other topics that connects with disparity, uh, political determinants of health, mistrust is all around health literacy. And a lot of people think when we were talking about health literacy, it's like, how do you dumb something down? But I don't think that that's what health literacy is all about. And health literacy is more about what, Dr. Carla?
Well, it's as it turns out, it's about knowing how to actually make the healthcare system work for you. The California Healthcare Foundation, I'm a board member of the foundation, recently published a report about the health of African Americans in California. And one of the impressive findings about the report is just how knowledgeable the African American community is about health and healthcare, um, and utilizes that knowledge to try to navigate the system and get the system to work for the community. And that's where we encounter barriers. People know about prevention. People know a lot about cancer care. People know a lot about diabetes. People know a lot about COVID-19. The real barrier is getting the system to do the things that people know that the system is supposed to be doing for you. That's where the system breaks down. We still are making sure that people understand all these things and have a high level of knowledge. And during COVID-19, for example, I and a number of my colleagues worked extremely hard to try to communicate the facts about the virus and the facts about the vaccines to counter some of the misknowledge that was out there. People were enhancing their medical literacy, but they were learning incorrect facts because they were using the internet to acquire that knowledge. But the internet is out there, it's accessible to many people. We know that that's a barrier that still exists, having adequate access to computers. But a lot of health literacy has to do with making sure that people have the right kind of knowledge. And when you're a health profession school, this is actually a lane that we operate in, making sure that people have the knowledge that they need to make the system do everything they can to make the system work for them in the best possible way.
And also it's a responsibility of the provider too, right? I think as a medical provider, my responsibility is to understand what do people understand and what do people not understand. And you always have to check in with them when you're seeing patients. Some people, I remember my mom was being seen by an oncologist, and I think he just liked to hear himself talk, right? Because he would come in and blah, 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 blah. And I was like, hold up. She doesn't know what you're talking about. And so, and I had to translate literally to say, I need for you to stop talking. Let me tell her what you said. And then now you can talk some more. But um, some people can study science their whole life and never learn how to talk to people. And I think that's one of the things that health literacy is all about, to be competent enough as a healthcare provider to know that when your patient leaves, they understood what was going on. Did you make the right analogy? Do you know how to translate that science into something that they can understand? I see people shaking their heads in here now, and I'm hoping that some of the newer healthcare providers, that that's something that you think about all the time, because it's people don't get to spend that much time with medical providers now. And so if they don't understand, they won't come back. And that's the other thing that we have to make sure of. So I think it's important when, how many of you are going to be seeing patients, the students over here? All of you guys? Okay. All right then. Well, and even those of you working in, what did you say you're doing? Okay. All right. So you're doing like a post back or something? Are you doing? Okay, all right. So any time you're seeing patients, it's important that they understand what just happened. So I think it's important to say to them things like, do you know why you're here? Do you know what we did? Do you understand the medicine? And do you have any questions? And do you know how to get in contact with me if anything happens? And I think if people know those kinds of questions, those are the most important things that are important to talk about.
That's a great topic, especially because, I mean, the question with our communities of need and opportunity and promise, um, they don't, I dare say, some of our communities don't know that they deserve quality care. They don't know that they have a right to ask questions. They don't know that they can be able to, ask until the person completely understands what the procedure will be. I think that, and I know that medical practitioners have a myriad of reasons to need to go on to the next patient, but I think it's uh, critical for each and every one of us to be part of that answer of health literacy. Each and every one of you should have your emergency kit that includes, the critical health insurance information, What are your anything, any allergies? You should already have that listed in the event that anything happens to you. As a layperson, but and I get to share, and the reason why I love being part of the Bolt family is because I'm given the opportunity to have wellness. Wellness, and that wellness at home is critical for me as well, because I get to be the caregiver. I don't have children, but I get to be a caregiver to my mother, who is terminally ill and who has dementia. And so then I've learned that I didn't know what bedside manners was about, and I learned that 20 years ago when I was asked by County USC to give a lecture, give uh, you know briefing on the LGBT community and what would be correct bedside manners to be sensitive to the LGBTQ community. And so after giving the briefing, quite frankly, I didn't know that there was such a thing as called bedside manners. And it's not until now that I get to be able to employ some of that language and learnings into how to be the better advocate, not only for my mother, but for myself, because many of our community members, we use a lot of that example of when you're on the airplane, when there's an emergency, you get to use the air mask for yourself first and then the person next to you. Well, guess what? A lot of our family members have never been on a plane, so don't understand that example in terms of what critical care looks like. So it's, again, meeting people where they're at, and not ever being afraid to be very clear about the direction of their health and what their life will, what's the ramification of this information.
Yeah, and that's important. I think I just wanted to say I talked to the clinicians over here, but for the folks who are receivers of healthcare who are in this audience, I think it's important for people to always feel like you can ask questions. There's never a dumb question when it comes to healthcare. And if you can't get an answer, get another healthcare provider. Because I think that's what it's more important to get the information than to just keep going to some place and not getting the answers that
You Deborah, if I could also add, following up on Liliana's statement about meeting people where they are. One thing that this university clearly demonstrated during the COVID-19 pandemic was exactly that. Early on in the pandemic, we thought it was a disease of, the west side of LA, international travelers. But anyone who knows anything about health and healthcare knows that there was a ticking time bomb going on in South Los Angeles. We didn't have testing resources, so people weren't getting diagnosed. Um, this university partnered with LA County Fire and others to bring testing to South Los Angeles. We started out at about 200 people a day. And then our testers, most of whom were students and other people associated with the university, basically said, we can do better. And they said, we can do better by going out into the community and telling people, come to CDU, you can get tested for free, regardless of things like health insurance status and immigration status. And you will know whether you have COVID-19 and whether you can take it home and endanger your families. Because our students were people who who lived in the neighborhood. They spoke the language of the neighborhood. They went to church with people in the neighborhood. They shopped with people in the neighborhood. The neighborhood said, aha, well, we can trust CDU to basically work with us. All of a sudden, we were doing 1,000, 1,200 tests a day. It became one of the highest volume testing centers in LA County. And it's because, again, we were meeting people where they were instead of having them come to us, basically. And that's an important message about healthcare. That's why it's important to have people who can look at a patient lying in a gurney and say, oh, you could be my father. You could be my grandmother. You could be my daughter. You could be my neighbor next door. I care about you implicitly. The patient knows when they see that provider cares for them implicitly as well.
exactly. Well said. Well said. We have about 5 more minutes. I just want to find out, are there any questions in the audience? We can take a few questions. People have any? Don't be shy. Yes, ma'am.
Is the program that you guys have for the students, the Science Saturdays. I grew up in Willowbrook. right down the street. Never in my life have I heard about the Science Saturdays. And I came with my daughter because my daughter is interested in being in the medical field when she grows up, and she's a high school student now. I am a board member to federally qualified health centers in East LA, which is, I grew up in the projects in East LA. And when they knocked those down, we moved it to 130th and San Pedro. So that's how I ended up going to Centennial in Compton. But what I wanted to know is about the program and how I can get my daughter involved. But the other thing is what your thoughts are on, our outreach in the community. You have built the trust. I've known about this organization I know it existed. I just turned 37. This is my first visit here. And so just kind of speaking a little bit to, reaching out to the community and letting them know that you exist and that you're here.
Yes, we've been called a hidden gem. And I'll just say it's about time that we took that word hidden and kind of crossed it off. Because we are a gem. We're the second ranked not-for-profit university in the country in terms of both student diversity and faculty diversity. We're ranked number 3 on some metrics in the country among 2,000 universities in terms of value added, distance travel. So students who start out very socioeconomically challenged by the midpoint of their careers, they're bringing resources back to the communities that they grew up in. So I would kind of extrapolate the metaphor to say that South Los Angeles can be viewed as being on the verge of a renaissance. This is kind of our time for this community, and the Chargers are part of that. I'll say the Chargers, NFL Network, SoFi Stadium, they're not technically located in what people would consider South Los Angeles, but when you think about Inglewood, Inglewood is South LA adjacent, and it has a South LA state of mind. And for the Chargers to be part of this community says a lot. CDU is committed to reaching out more and more to this community as well, because we want to make sure the community is experiencing the full benefits that we bring to this community. Absolutely. So we'll talk afterwards as well.
Did you have a question?
Testimony, I guess. So first, thank y'all. I'm gonna nerd out a bit because when we talk about health equity, that's essentially what runs through my veins. In terms of what I want to teach students and the like. First, this is what equity looks like. We have women of color. We have a Black leader leading in the university. Systems are meant to do what they're doing, not open up opportunities and doors. And what this university is doing is working against that status quo. And so with that, we also have representation of what's not considered healthcare, right? Like, what are their chargers doing here? What can they speak to, right? But the thing is that that's exactly it. That's what we need. We need collaboration. We need to come together because health doesn't stop at a hospital, right? What you all are doing, what you've shared, Liliana, about what's happening with you all and the work that you're doing in community is exactly what we should be doing. So I'm just totally like nerding out to y'all. Just another piece on how do we not know about Drew? So I went to high school right next door, and I benefited from a research program that Drew was starting up. And my science teacher recommended me. I applied. I got in. That's how I found out about Drew, because I was lucky to be at the school next door. And the thing is that now, fast forward with time, it's no longer about luck. It's about being out and being sort of a tentacle into the community. And so the pipeline programs and Saturday Science Academy and all of that are going into the schools and reaching out. Drew's at Centennial, Drew is at King Drew at Jordan. A lot of the faculty here, including myself, born and raised in Watts, still live in Watts. We're doing community-based, community-engaged research and, what we call participatory engagement, making sure that the people impacted by what we're talking about are actually involved in the decision-making process, right? So all of that happens. So as much as we know the knowledge of disparities, there's a difference in this way and that. Equity means that we're actually taking action, that we're actually doing the work. And hopefully you all have heard that in that space. So thank you for your leadership, Dr. Carlisle. Thank you all for being here.
Yeah,
Thank you, Doctor.
Yeah, I love that testimony.
This is a professor. I want to underscore Professor Cynthia Gonzalez.
Yes.
Because
Professor.
she's part of our university. I want to say there's a phrase that we use here. I mean, we consider ourselves to be a community-founded university. We're only here because of this community and what it needs. And that is what we are motivated to serve. And we use the term, a house that is built for you is better than one where you're only a visitor.
Right.
And we are the house that is built for this community in higher education.
So two things about what you said, Cynthia. I too was here doing a rotation in community health, and someone recommended the PA program to me. I didn't know what the PA program was, but I trusted the people, and I got into the PA program. They're like, it's going to be good. It's going to be something really big, because I was in a way back, like Medics 3 is one of the programs that I was in. So I just say that to say that uh, trusting leaders and people here at the university is important too. And the other thing about being working with the Chargers, I was at a program earlier this week, and we talked about taking back the word intersectionality. You know, people are trying to do something negative around intersectionality, but this is what intersectionality is all about too. People who have the same kind of interests and the same kind of goals coming together and working in that direction. So let's own that word, and let's work together when it comes to doing good things in the community. But we have some fun coming up. We have 3 footballs to give away to some guests in here. But you got to answer the questions correctly. So hopefully you've been paying attention. The first question is, where did the Chargers originally start? They're here in Los Angeles, but where did they originally start? Back here. No. Did they start in Stockton? No? Okay.
I apologize. I kind of tripped you all up front on this.
The owners were in Stockton. Owners were in Stockton. Yes, yes, in Los Angeles. Oh, yay, you get a football. And you get a football. All right. Okay. One of the other questions is, um, what was Dr. Charles Drew known for? Your hand went up first. Blood transfusions. Correct. You get a football. Liliana, you want to ask a question?
Sure.
Okay.
What are the official colors of the Chargers football team?
What is it? All right. Golden, white, and blue. And you
Powder blue, but we'll take it.
get a football.
Thank you.
Right. This has been a pleasure. It's always nice for me to come back home, and it's been a pleasure talking to you guys today. So thank you for your time, and thank all
Let's
of
hear it for Deborah.
you. Yes.
Oh my gosh, she was amazing. Thank you.
Thank you. So we have some refreshments still outside if people want to go get something to eat. And are there any other last comments before I step away? Anybody? I'm sorry. Thank you.
You guys are amazing. I
Good. And this is a nice thing for you, Natalie. Right.
Thank you.
Thank you. Thank you for coming, man. Yes. Right. Mm-hmm. Yeah. Yeah. So yeah, don't let them, blow us away like that, in terms of it's not that we're doing worse, we just get to it late, and you've heard people say when white people have a cold, black people have pneumonia.
Yes.
No? So that's something to think about too. All right. Thank you very much.
Thank you very much.
I think they Way up here.